Good morning, Adians. To start off our morning newscast, we're going to talk about the MMR vaccine. So, Michaela, if I wanted to get an MMR vaccine, what will be covered?
Well, Taylor, the infections this vaccine protects against are measles, mumps, and rubella. The symptoms for measles are a fever, cough, runny nose, conjunctivitis, and a red pinpoint rash that starts on the face and spreads to the rest of the body. The symptoms for mumps include swelling of glands below the ears and the appearance of chipmunk cheeks. Rubella can cause a mild rash on the face, swelling of glands behind the ears and of small joints, and a low-grade fever. The measles are highly contagious viral infection through aerosol transmission of fluids from the nose or mouth. Mumps and rubella are viral diseases spread by airborne droplets. There is no prescription medication to treat measles, mumps, or rubella. However, getting sufficient sleep and drinking plenty of fluids can assist. The measles resulted in 145,700 deaths globally in the year of 2013. The mumps has a fatality rate worldwide in 1 in 10,000 cases. Before a vaccine was available, the rubella outbreak in 1963 in the United States led 12 million people to develop the disease and 11,000 deaths of fetuses. After the vaccine was accessible, the number of cases and deaths globally dropped drastically. Now back to Taylor for more information.
Thank you, Michaela. The vaccine should be administered when the child is 1 year old and then again when the child enters school, normally around the age to 4 to 5. This is a 2-dose vaccine because the second dose helps the 3 to 5% of people who fail to develop the measles immunity after the first dose. Now moving on, my colleague, Colin, will answer any questions you may have based on what you've heard in the past about this vaccine.
Well, Taylor, a very popular myth surrounding the MMR vaccine is that it causes autism. Dr. Wakefield published an article in 1998 that claimed that the MMR vaccine was related to autism. This was later proved untrue after the Food and Drug Administration tested the preservative thimerosal that is in the MMR vaccine. The Food and Drug Administration conducted that thimerosal was not linked to neurological harm. Multiple studies were later conducted, and they all reached the same conclusion that the MMR vaccine was not linked to autism. Dr. Wakefield's paper was produced in 1998 and created a panic throughout the United States. In 2000, there were 770,000 deaths resulting from measles. These could have been prevented if he did not falsify his findings. Now we'll go to Hannah to discuss the side effects and potential costs of the MMR vaccine.
Oh, thanks, Colin. To answer some of your questions, as with any vaccine, the MMR vaccine has some common side effects like fever, mild rash, and swelling of the glands in the neck and the teeth. These are most likely to be seen 7 to 12 days after the first administration and become less common after the second administration. More serious side effects may include seizure from fever, temporary low platelet count, pain and stiffness of joints, serious allergic reaction, deafness, long-term seizures, coma, lower consciousness, or permanent brain damage. As for the cost, according to the healthcare blue book, the price of the MMR vaccine is $67 at a walk-in clinic and $116 at a physician's office. Healthcare providers do cover the cost of the vaccine and other preventative measures, but the coverage can vary between companies. Those covered under the Affordable Care Act also do not have to pay for the vaccine. Now to Taylor for closing.
Thank you, Hannah. This vaccine is located at most clinical settings in stores like Walgreens, CVS, and Rite Aid. We would like to thank you for watching our segment on the MMR vaccine, and we hope that you will vaccinate your babies. Peace out, Adians.